Foreign DNA, if you want to introduce into a viral vector, what is the process? Transduction. Then allosteric inhibition is typically a thing that you see with 2,3-DPG. Hemoglobin is controlled by, affinity for oxygen is controlled by 2,3-DPG, right? Why fetal hemoglobin has a less ability to be an oxygen carrier than adult hemoglobin? Because of its poor affinity for 2,3-DPG. If hemoglobin can't bind to 2,3-DPG, it binds tightly with oxygen. If it binds too tightly with oxygen, it can't deliver oxygen, right? So that is how fetal hemoglobin differs from adult hemoglobin. And the influence of 2,3-DPG is called allosteric inhibition, right? Allosteric effect, modulation. Seropositive arthritis, you have multiple joints, symmetric joints, joint pain, joint swelling, easiest question in the world. All of the above are all correct. Now, typically a neurogenic tumor is a posterior mediastinal tumor, not a anterior mediastinal tumor. Struvite stone is the one which is a magnesium ammonium phosphate stone found with the Proteus infection, UTI, caused by Proteus. Graves' disease is more common in females. Bailey and Love, all Graves pictures are all female pictures only, no? But I have seen hundreds of patients who are male Graves, right? That's the difference between practice and study, right? Now, aldosterone synthesis. How is it basically? What stimulates aldosterone? Aldosterone causes the retention of sodium and loss of potassium. Whenever you have hyperkalemia, that tells the adrenal to produce aldosterone so that all that hyperkalemia is drained into urine. So hyperkalemia stimulates aldosterone, hypokalemia inhibits aldosterone production. Okay. Now, Alzheimer's disease, it is not curable. It is progressive. There is no cure. Only donepezil, rivastigmine, galantamine, they don't prevent the progression of the Alzheimer. Then about vitamin K, if you happen to use prolonged antimicrobials, then that can lead to the development of the deficiency of the vitamin K, is what you need to remember. Then if you are using oral anticoagulant like warfarin, coumarin derivatives, you have to check the INR value, right? You need to manage the INR. Cutaneous lymphoma is very common in those who are very elderly and with a very weakened immune system, like HIV individuals. Then what is AIDS related complex? In that there are a list of symptoms that define an AIDS related complex. What are they? Long lasting diarrhea, heavy weight loss, long lasting fever, night sweats, etc., etc. That's called defining illnesses of HIV, AIDS. Then chordoma. Typically, how do you treat chordoma? Proton therapy is the one which is used. Very difficult question to answer. Then a woman has pulmonary embolism, bedridden background. So CT angiography, earlier they used to do conventional angiography. Now we are doing a virtual CT angiography, is a way by which you can be able to detect. Of course, this is a different question. She is having, liver autopsy, and that liver autopsy was showing a lot of mets. From where does mets come? Entire gut is very well connected by blood supply with liver. So liver is like the central chaurasta. So that's the reason colonic metastasis can go to liver very much. Now, is there a MR vaccination campaign launched? Measles rubella. Yes. India has very much launched it. Now, hemophilia A, another very Easy question, like color blindness is X-linked. Everybody, even a newborn baby knows it is factor 8 which is decreased. Then marked bleeding, where do you see? In all these things, hemophilia A, B, etc., etc. Then Reed-Steinberg cell, Hodgkin's, a well-known question, no challenge. Now a bedridden patient has chest pain with breathlessness, example of pulmonary embolism. Typically seen, detected by doing CT scan is what you need to remember. Chordoma, how does it arise? By the very name it arises from notochord. Progesterone only pill will make the cervical mucus become very thick. It will suppress the ovulation, etc., etc. That's how it functions. Saturnine gout means those who are having lead poisoning, they end up with urate precipitation called saturnine gout. Then bone resorption को prevent करने वाला drugs क्या होता है in osteoporotic individuals? Favorite question of examiner. So typically risedronate, like alendronate. There will also be 35 mg prolonged slow release tablets. They are basically, they inhibit the osteoclast proliferation. Then teriparatide, don't forget, is another very important drug. It is an analog of parathormone and it is used to improve the architecture of osteoporosis. Salmon calcitonin, which is being inhaled, excellently working for the bone pain in osteoporotics. You should not forget. Phenylketonuria is deficiency of phenylalanine hydroxylase. Then do you want to operate hematoma or how do you want to manage hematoma? You must know what is meant by RICE. Rest, ice, compress, elevate is the way you manage any hematoma. Basically, you don't do the काटते नहीं उसको. Then strict classification of donation after cardiac death. Impossible question unless paper is out, right? What category is it? That is the literature. So even if you take AIMS exam or any exam, some out of the frequency questions होता है. AIMS में negative marking है क्या? है? There है? Already you are habituated for AIMS, no? So you should know गोली कहाँ मारना, नहीं मारना. That's very important. This kind of questions, just jump and go forward. So see, 300 questions में 100 questions give you a feeling that एक कुछ क्वेश्चन है क्या, वैसा फीलिंग आता 100 को देखे तो. 100 I expected bloody you will come, you came. Come on, let me kill you kind of questions. It should be a sport. 120 questions should be like that. 220 khatam. 80 questions. 50. Bhagwan mujhe maaf karo. What is the great prayer? God, give me the strength to change the things that I can change in this world. And let me accept the things that I cannot change. Above all, give me the wisdom to differentiate the two. That is the simple prayer when you go for NEET PG. भगवान जो मैं नहीं पढ़ा उसको कैसे भी आंसर नहीं कर पाऊंगा. जिसको पढ़ने के बाद भी जो आंसर नहीं कर पाएगा, वैसे सिली क्वेश्चंस होता है, उसको छोड़ देंगे. मुझे जो मैं पढ़ा, let me remember well and answer, give me the strength to answer them correctly. Most important, give me the wisdom to identify किसको छोड़ना, negative marking से दूर रहना. That is what the prayer, single liner prayer before you go for NEET PG, right? So what is the cause of myocardial shock other than MI? All of them can cause septal rupture after the MI, right ventricular shock, anything can cause a shock. Then nitric oxide acts by Cyclic GMP, very old, everyone knows. For Pass positive macrophages typically found in Whipple's disease, Trophyriema whippli. In the jejunum, if you do the biopsy, you find glycogen stains positive for Pass, periodic acid chip stain. So Pass positive granules will be found. A boy has multiple non-suppurative osteomyelitis with sickle cell anemia. All of you know Salmonella osteomyelitis is very common. But what is meaning of pathology? A hiker, not there. Lot of things are not there or what? Most of them are there. Okay. Then 1 year, this is there. 1 year weighing 6 kg is suffering from acute gastroenteritis with sunken eyes, means severe dehydration. So how do you manage severe dehydration? Forget about entrance exam. Being a doctor, minimum courtesy how to manage the dehydration of pediatric patient. Infuse 180 ml in the first hour followed by 420 ml in the next 5 hours based upon the weight you have to calculate. Right? Now, Malpighian layer, is there or no? We don't know. We don't remember also. 300 is very big number. So, spinosum plus basal constitute. Actually, basal only is germinal or Malpighian layer. Colchicine, acute gout is xanthine oxidase deficiency. Then oxygen therapy, where do you use? Generally in fibrosis, pulmonary fibrosis, oxygen therapy is not much of use. Asthma, pneumonia, subglottic stenosis, in all these areas oxygen therapy is very much useful. Sometimes oxygen therapy can have a negative impact in few scenarios. It will suppress the respiratory drive and patient can go into arrest. One of them is pulmonary fibrosis or a paraquat poisoning, etc., etc. A newborn baby, heart rate less than 60. How can you be able to resuscitate him? Tactile stimulation, oxygen therapy, chest compression, they are all used, not by slapping the neck. Then Mobitz type 2. What is Mobitz type 1? Type 2. If the PR prolongation is occurring progressively and Wenckebach phenomena is seen and then there is a drop of the QRS, P wave will be there, QRS, then that is called Mobitz type 1. Sudden block ho gaye to type 2. Typically the underlying causes will be any pathology involving the AV node. But one is expected to know what is type 2. Etiology of type 2 kisko मालूम होता है? भगवान को मालूम होता है. So when do you call ARDS? You call ARDS, acute respiratory distress syndrome, only if there is no ventricular dysfunction. So that you have to assess whether ventricular dysfunction, if the ventricle is dysfunctional, cardiac enlargement is there, pulmonary edema is there, then it is not called ARDS. ARDS by definition is a non-cardiogenic pulmonary edema. So you look at the age, timing, origin of edema, oxygenation, LV dysfunction, high or high. Based on that, you have to take a call whether it is ARDS or not. Large amount of ascites, bubble wall thickening, strangulated bubble segment which is gangrenous. How do you want to do anastomosis? So you will be using a single layer seromuscular suture which is called as the Lambert suture, because that will affect very little. Blood supply ko kuch bhi effect nahi karega. That's called Lambert suture. Typically in ventricular fibrillation and cardiac arrest. So being doctors, ultimately we should know how to protect our heart after writing NEET PG and others' heart, right? So you should know what are the drugs that are used. We will also use lignocaine, amiodarone, A shock, B shock, shock, amiodarone, Bertillon, then lignocaine, right? So you will be using amiodarone also. So that brings us to the end. With courage, we should accept what is the truth, and if you get a very good rank, join the post-graduation. That's a one chapter opens. Otherwise, we are in queue of opportunity. Without wasting much time in regret, we should quickly pick up 650 high yield topics and then start our preparation and get ready for the next forthcoming AIMS, PGI, DNB, etc. Generally, you are able to clear the DNB in June, means you have your Glasgow coma skill is better. You are ready for cracking that means you finished a major part of the 650 topics. So, whether you get the seat or not, we will be there in eternity to help you to prepare. So, our weekend sessions start from Feb 7th onwards. So, please do come and join, and we will work with you and check why you will not get the seat. Thank you.